I thought I'd share. Rishi was kind enough to kind of hold some space for me to share. I kind of glazed over in my own presentation. So I thought I'd just kind of share for those who were on this morning or maybe weren't, a little bit more of like how we really incorporate this into kind of the broader picture, which Rishi, you did a fantastic job of sharing as well. So grateful. Um, so I'll do a quick screen share here. So well, I kind of mentioned in my presentation, so here's some of the themes that Rishi mentioned that we found. So systemic oppression, food, nutrition insecurity, predatory food industry practices, and actually let me go back to, yeah, here's where I wanted to start. So the percentages that you're seeing in parentheses here are the percent of participants who endorsed this theme spontaneously. So they described this theme. I didn't ask them about it. They weren't prompted. These were just really the themes that experts associated with binge eating disorder. And so systemic issues and systematic oppression, marginalization, which included lack of access to resources. I just couldn't fit that all on, in one, what's the word I'm looking for here? One line. Research, so gaps in clinical research and clinical care, invalidation, invalidating environments and experiences. Those themes were identified by all experts in our study. Stigmatization and discrimination, economic precarity, trauma and adversity, food insecurity, interpersonal factors, social messaging and social media, nutrition scarcity, and then predatory food industry practices and environments. And out of those, that last one was actually the only one that I had anticipated. So here we've got our themes, and we published this data in 2022. Qualitative data can be really difficult to communicate. Kind of the best tools that I had was reading quotes, showing quotes, and it was kind of an eyesore on a presentation. And so we had, very gratefully, both Rishi and Barbara Kalu, who is another one of our, actually, let me actually go backwards here in my slide set if I can. Um, Yeah, here we go. So Barbara Kalu is a clinical mental health counseling master's student at Johns Hopkins. Barbara was our third staff member, so she came on very shortly after Rishi. And, again, getting her master's in clinical mental health and has managed our social media and kind of social marketing team and has really been our social media and social marketing team. And she's developed these beautiful infographics like this one that you're seeing here that really can enable me and others at Nourish to present this data in a way that can tell a story, and it's not an eyesore. So here we're just kind of seeing that binge eating disorder often is just the tip of the iceberg. And there's all these environmental factors that often go unnoticed, unrepresented, and overlooked, particularly in clinical care. But as we've kind of heard throughout the day today, are really important to address for a variety of different reasons. So these infographics have been really helpful in communicating qualitative data and mixed methods data. And then, of course, Rishi's work has really enabled us to take this one step further and in mixed methods research, where we have qualitative and quantitative components. I think that this way of communicating this data is just brilliant. As said, it really enables us to communicate the complexity, the way that all of these themes and sub-themes and really, factors are connected to one another. And another thing that's really cool is with Kumu in particular, is that it offers us some social networking tools to conduct kind of social networking analyses. And again, Rishi, did a fantastic job of sharing this. So the way that I kind of think about this data is, we have the kind of biopsychosocial theory, or construct. So we can kind of place these domains, mental health, physical health, social health, which I would really call public health and social welfare. And when I kind of started looking at this data after Rishi had set everything up for us in Kumu, so I added in these themes. I added in binge eating disorder, of course, as our center. Then I added in this kind of field of psychoneuroendoimmunomicrobiology. Now, that's a big mouthful, but it really describes a variety of different markers that we can use to assess ways in which the brain, the stress system, the immune system, or the gut might become dysregulated. And also nods to the fact that these are all related. So changes in the gut can result in changes in the immune system and the immune response, changes in the stress system and the stress response, changes in the brain functioning and cognition. And likewise, changes in the stress system can cause all these other changes. Changes in immune function can cause all these other changes. And they're absolutely linked, not just to mental health, but also to physical health and to social health. And I talked about this, quite a bit in my talk. PJ did a really beautiful job of demonstrating this, right? The way that these social factors can impact our physical health and our mental health because they really are all related. And that's not just a woo-woo concept. We have really solid empirical data to show that these systems are all linked, right? So I just kind of threw that in there. Um, and then, just as Rishi showed, started kind of adding in, the different themes. So here we've got gaps in clinical research and care, invalidation, marginalization, systemic oppression, economic insecurity, food insecurity, or economic precarity, food insecurity, nutrition scarcity, stigmatization, interpersonal factors, social media and messaging, trauma and adversity, and food, predatory food industry practices. And as you can see, these are all more social issues, which is why my 2022 publication was titled Binge Eating Disorder is a Social Justice Issue. So the environmental factors that experts associate with binge eating disorder are social justice issues largely. So we kind of plotted that out. And then I kind of separated these so that you can just see all the different connections. We mapped in Kumu, you kind of, add in your themes or elements, almost on like it's not an Excel spreadsheet, but it's very similar to that. And then you can add in your connections. So we added in all the connections as they were described as being connected by experts in my 2022 publication. You can just see these are all really interrelated. Then, Rishi kind of showed this slide. We took out that construct and just showed how these themes are related to one another. Again, just so you can get a feel for all of the connections that exist between these. And then we added in our sub themes, which can make things get really messy really quickly, right? But I think a better word for messy is complex. These things are very complex and they're very highly nuanced, and we can see COVID-19 pandemic, taking patient narratives, insurance systems, eating disorder research as a field, stigmatization in healthcare systems, federal funding for eating disorder research, interpersonal deficits, body weight, shape, size. It goes on reward dysregulation, the food industry, nutrition scarcity, down here, we have different factors of marginalization. So we've got discrimination, the male sex or gender orientation, age, religion, BIPOC community members, LGBTQ2 plus community members. So it just gives us a really colors in the picture, and accounts for all of these different shades and colors that this really isn't just a black and white kind of binary issue. So then we scope back out and show that within our framework. Again, we're just really seeing these are largely kind of social justice issues. Here we've got the COVID-19 pandemic, which kind of offers, both social and physical as well as mental health. Really, all of these would fall right here in the center where we're seeing binge eating disorder. Played around with that a little bit, kind of did some different configurations, which is really amazing that Kumu allows us to do. Took the center binge eating disorder out and just showed these themes relating to one another. And then we get into this really cool kind of these social networking analyses that we can do. So the first one that we did, and this is where I didn't, Rishi's been so kind to enable me some time to kind of elaborate on this. So Kumu offers these really cool tools. So we have matrix of cross-impact multiplications applied to classification, which we just abbreviate as MICMAC for short. Most people just know this as MICMAC. MICMAC is a system analysis metric that explores element exposure and influence. The elements in this case are our themes and sub-themes here. So we can look at in these themes and sub-themes, how exposed they are. So how much one element is affected by another element. We can look at how resilient they are, and we can also look at their influence. So how much a single element affects other elements in the system. So when plotted on an XY axis, these scores can help identify potential leverage points within the overall system. So we really wanted to focus here on the MICMAC influence, the extent to which one element, theme, or subtheme can influence other themes or subthemes in the system, as well as the system as a whole, right? If our goal is to help improve outcomes, reduce prevalence rates for binge eating disorder, then it behooves us to know which of these elements might hold the most influence, kind of have the biggest bang for our buck, so to speak. So when we're looking at MICMAC influence, high values indicate high leverage with the changes kind of rippling outward. And what we see just when we're looking at influence is that we get a little bit of a different story here. So systematic oppression and systematic gaps was found in this analysis to have the highest MICMAC influence, which aligns with its endorsement. Experts kind of gave this 100, all experts endorsed this theme, and it was largely the most predominant theme that I identified. Justice in legal systems, which only one expert identified, so it only had 7% expert endorsement, was recognized as having the second highest MICMAC influence. That aligns with kind of my analysis. Remember the publication was titled Binge Eating Disorder as a Social Justice Issue. So it really, um, in kind of a unique way, accounts for the impacts that social justice have on binge eating disorder. Then we see economic insecurity, insurance systems, which again, only 64% of experts identified as being relevant to binge eating disorder, but has a MICMAC factor of 0.85. Predatory food industry practices, interpersonal relating. So these top five here, they're all really, again, social justice issues, and they're systemic. They're systems, right? So after I looked at this, I went through and just, subjectively highlighted which of these elements might have greater feasibility for change. Where if we're wanting to invest resources into changing the system, where might those resources be best spent? So the first one is insurance systems, which, at Nourish, this is not something that we are, I would say we're not experts in this. We don't interact with insurance systems, but I do hear a lot of our partners talking about insurance systems and insurance coverage compensation. I happen to work in the emergency department in the medical scribe industry for over 10 years. So I do have a little bit of a, kind of adjacent interaction with insurance systems. But our partners at Project Heal work with care coordination. They work with insurance systems quite a bit. So I just want to really underscore here, insurance systems are a really important piece in binge eating disorder healing and in the prevalence of binge eating disorder. Food industry, predatory food industry practices. We had David Bryant come speak yesterday evening, Friday evening, on the legal side of food systems and food regulations. And, so that's again, it's one that I wouldn't say that us at Nourished have a huge ability to impact change, but it is one that is a little bit more malleable, I'd say, and where there are folks really working to impact change there. Then we have interpersonal relating, and I kind of, as Rishi shared and as I mentioned, interpersonal therapy is one of two recommended psychotherapies that are guideline, according to APA guidelines for binge eating disorder, right? So interpersonal relating is a big one. We also had Matthew Hicks share findings yesterday on findings from his feasibility study on group psilocybin-assisted therapy. And one of the things that he said was folks reported feeling more comfortable in interpersonal relations, right? And he kind of shared on the elements that the group aspect of the psilocybin assisted therapy had, but a lot of that was attributed to the psilocybin, the medicine itself. Then we have nutrition scarcity, right? And so often when folks have low socioeconomic status, um, maybe they're, and, as well as geographic systems, maybe they're living in food deserts where they don't have access to, good high quality, good nutrition. Folks who have low socioeconomic status, often, organic fruits and vegetables are more expensive. If you live in a food desert, then having access to those foods requires time, transportation, resources. And then folks, who are reliant on government assistance, oftentimes the foods that you find in food pantries and through food stamps and things, not through food stamps, but food pantries, maybe they're not always the most nutritious foods, right? You might want foods with higher shelf life. I offer, frozen foods can do that as well, but when we're thinking about foods that are more shelf stable, those are often highly processed foods and they often have low nutritional density. So just kind of really trying to um, trying to help work with folks with low socioeconomic status and find solutions that are still nutritious is something that we do really value at Nourished. And we've actually put in a grant uh, earlier this year that we didn't get. Unfortunately, there were a lot of grants going in, but we've put in grants to help try to work with food pantries to offer nutrition counseling to folks using food pantries, things like this. This is something that I think is really important. And then, school systems, sex, gender identity, those really aren't things that we can't really change school systems. Federal funding for binge eating disorder research. Again, that's not one that we have much control over, but it is one that's really important. And then addressing gaps in clinical research and care. And so for us at Nourish, this is where we really, kind of come in, where we can kind of try to address these gaps in clinical research, clinical care. And again, we're coming in at the element that is like 11th on the list of MICMAC influence, but it's where we can come in really, right? And then down here, again, 15th, stigmatization in healthcare systems. And again, this is something we really prioritize at Nourished. We do offer trainings as well as resources for healthcare providers, healthcare organizations and administrations. So if you're a provider, and maybe you have a patient who has high weight, and you think that that's really important to discuss because it increases their risk for cardiometabolic disease, hyperlipidemia, hypertension, hypercholesterolemia. As I mentioned, Philippa Hay does have some work showing that overweight and obesity don't necessarily increase health risk in folks with binge eating disorder. But for many it does. And if that is important for you to address, we offer some tools and some support on how you can address that, knowing that you're going to be encroaching, you're going to be walking on a landmine of trauma often. So how you can have those conversations while still, holding your patient's humanity kind of first and foremost, and being really trauma informed around that. So that's MICMAC influence. How are we doing on time here? Does anyone mind just unmuting and letting me know what time it is? I'm not able to see a time.
It's 5:38.
Oh, perfect. Thank you. So I've got a little bit more. So that's MICMAC influence. And then we can also look at out degree. So out degree measures the number of outgoing connections for an element. And again, an element in this case would be a theme or a subtheme. In general, elements with higher out degree can reach a higher number of other elements, themes, subthemes, and spark the flow of information across a network. They may not be the most efficient at spreading the information, but they have the most outgoing sources, right? So this might be like your gossip element or theme. So basically, out degree is the number of outgoing connections. Higher values are going to indicate that the element actively influences others. So it suggests a strong candidate for change, as does MICMAC influence. When we look at out degree or outgoing connections, We see that the elements, themes, subthemes with the highest out degree are again systemic oppression and systematic gaps, which also had the highest MICMAC influence, was endorsed by 100% of experts without prompting, has 39 outgoing connections. Then marginalization, which also was endorsed by 100% of experts, has 31 outgoing connections. So this would be, individuals of marginalized communities, a lack of access to resources, things like this. Then invalidation, stigmatization in healthcare systems, and gaps in clinical research and care. And then the list goes down here. Now, if we look at this list of out degree connections and we look at which of these elements maybe have higher feasibility for change, this looks a little bit more positive for us, right? So stigmatization in healthcare systems, as I've already named, is something that we really prioritize at Nourished, and this ranks fourth on the list of out degree or outgoing connections. Gaps in clinical research and care as well, something we really, prioritize and address at Nourished. And this is fifth on the list. So that's, pretty hopeful. And then we see the predatory food industry practices. I tend to shy away from this one a little bit at Nourished. I think that it is really important. It also gets very highly socio-political, and can be a concept that's more polarized in the field. It's one that I value deeply, 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 and I think that it is so important. We tend to address it less at Nourished. I'll just kind of name that, but it is really important, and it's six on the out degree list. Then if we kind of look lower, body weight, shape, size, bias, which kind of goes along with stigmatization, is 11th on the list. That also is something that we, really prioritize at Nourished. And then 15th, call for public education. And as I mentioned, we really prioritize our social media presence at Nourished, and kind of using social media campaigns to help change the environments that eating disorders occur in. So that's kind of an alignment there. So that was kind of reassuring for us, for me, for us at Nourished, to see that we really are kind of investing our resources, right where we might want to be or should be. But these tools are just so helpful. Um, and I'll go on. I just want to add here, Rishi kind of named that, we're getting ready to put out a publication on treatment access barriers. And then Rishi is going to kind of apply the same network mapping protocol and the social network analyses here. So it makes me really excited. I think the last analysis metric that I'll show is reach efficiency. So Kumu offers, the metrics that they offer in their social network analyses are amazing and quite robust. I think there's maybe somewhere between, 15, if I'm guessing, different metrics. Reach is one of them, and I won't show reach, but I'll describe it, and then we'll talk more about reach efficiency. So reach measures the portion of the network that are within two steps of an element. So if we're looking at, gaps in clinical research and care, we're seeing one, two, three, four, five, maybe outgoing, immediate primary connections. And then if we were to follow that through and say, okay, well, gaps in clinical research and care links, it has a connection to marginalization. And then how many links does marginalization have? Marginalization has a million links, right? So that would be reach, is how much of the network is within two connections of this element. Reach efficiency normalizes reach by dividing it by size or the number of neighbors. So in general, elements with high reach efficiency are going to be less connected, but gain more exposure throughout each direct relationship. So reach efficiency is reach divided by size. It measures influence per connection. Higher values are going to indicate efficient influence with few but powerful links. And when we look at reach efficiency, we're getting a little bit of a different story here. So insurance systems comes out as having actually the highest reach efficiency with a value of 0.12. And again, that was endorsed by just 64% of experts, so over half. But I think, often that is overlooked. And I'll just kind of name in research, There's a large, I think, percentage of folks who are clinical researchers, who they have a clinical practice and they also do research. But in the field, and I think this is true of research in general, we also have a lot of researchers who are not clinicians, and we don't really work with insurance systems. So it can be easy to overlook that piece. But what we're seeing is that's a really important piece, and it has the most efficient reach. Um, so insurance systems, urbanization factors, which I think PJ did such a beautiful job of speaking to. We actually had one expert who mentioned urbanization factors as an environmental factor. But here we're seeing it has very high reach efficiency, 0.11. Trauma and adversity, male sex or gender, federal funding for binge eating disorder research. So these were the top five. And then again, if we look at which of these elements have, maybe high feasibility that we can maybe change, we're seeing federal funding for binge eating disorder research comes in fifth, call for public education here comes in ninth, eating disorder research as a field. So, kind of dismantling the swag stereotype and the anorexocentric thinking in the field of eating disorder research, having more inclusive research. That's one that we deeply prioritize at Nourish. And then childhood adverse food experiences. I kind of talk to the work that we do, in trying to increase nutrition access in food pantries, things like this, and then nutrition scarcity. And I think I will pause it there and